Artery insufficiency, where one of the arteries along the side of the neck is blocked or occluded, or has a tendency to have an aneurysm in it, which would mean that the blood could be compromised to the brain. If we stress that artery, it could go into spasm and cause some sort of insufficient blood flow to the brain, temporarily or long term. So this is a safety test to make sure that you don't cause any harm. It's good to do it on the initial visit when you first meet the patient and you start to do the stretching of that area. Just do this test before the motion glide technique. So the artery runs along both sides of the neck and goes into the circle of Willis, into the brain. So it's very important to keep it clear. Some old people have a occlusion because of degeneration of the vertebral artery through the articular pillar along the spine. The cervical spine gets degenerative spurs which can put pressure on it, or they have calcification of the artery itself, or younger people could have a berry aneurysm or a malformation in the vertebra itself, causing a misalignment of the artery or a junction in the artery that's stopping the flow. People with blood disorders and high blood pressure are higher risk to have some sort of aneurysm event. So we do this test to see if they are going to have some sort of problem with adjusting the cervical spine with the normal conventional lateral brake. So you just ask the patient to come over off the end of the table, right off. So it's a good thing to do if you're doing motion glide. You'll see it, you take their head down and just let it flop over your finger, support it there, and you watch their eyes. And if there is an effect, which is their eyes start to move backwards and forward, like sideways, like a real quick movement, that means their artery is not in a good situation, and you're better off referring them to get a Doppler ultrasound of that artery. And you can test the opposite side by causing a little bit of occlusion in that one and bending it that way and back. Extension's always more stressful on this. So it's called nystagmus when the eye starts moving like crazy. It goes zzz, backwards and forward, okay? So I don't see anything like that. So that you hold it for 20 seconds and then you let it out. That's enough time to see any effects. Usually if somebody has a problem with this, they'll start doing it straight away anyway. Okay, slide down, done. Okay.